Okay, we are on to the last section in week 2, and this is about Medicaid. What is Medicaid? How is it different from Medicare? Medicaid covers a broad range of services, and it covers the same as Medicare. It covers that inpatient, outpatient, prescription drugs, those kind of things. It covers all those different services. Medicaid provides services to mainly people with low income. It also provides services to people with disabilities. And so it's administered by the state. And so medical assistance is one of the big programs that people are familiar with. It's the Medicaid program, medical assistance. And so it provides coverage for that. People who can't afford insurance, it certainly makes sense. On the disabilities, if you think about it, people with disabilities have unusually high medical expenses. And so what they used to do back years ago, and this is my disability service experience coming into play, is what they used to do is they would hospitalize kids because they needed a lot of care and 24/7 care and watch. And so they would hospitalize people with disabilities and put them in a hospital. And then parents would come and visit their children or visit their person as they grew older with a disability at the hospital. Well, they found out that that system really didn't work. What happened is the costs were extensively high for all the 24/7 care, and the care needs really weren't being met. People who needed to be washed up after going to the bathroom, all those different care needs, they were being neglected. And so in some cases, in many cases, it resulted in people living in devastating results. And it also separated parents and children from each other, which created a devastating impact in itself in separating the parents and children. So there became a new process, a new thought process about how people with disabilities would be cared for. And the change in thought process was children with disabilities are better off with their parents. However, because they have super high care needs and they have all that, let's take all the money that we were throwing in the hospital care and provide services so that the parents can get the services they need. They can bring somebody in for added support. They can bring in the equipment they need. They can get the various services within their home environment to be able to provide for that child. And so it was a change in a way of thinking of that. Often people with disabilities, their medical expenses are super high. And so if you were a parent with someone with disabilities and you were trying to get insurance from your employer, somebody with disabilities could take that whole plan and take a big part of that plan or a big chunk of that plan, result in everybody having to pay super high costs. So allowing people with disabilities to go on the Medicaid prevents that type of problem from happening, so the parents still could work, they could get the support they need at the home, and they could still provide the services. So that's another example of how Medicaid is used in the system from my disability experience. Each state has different governing with the Medicaid, and so they have significant authority over it, and some things are overall. For instance, reimbursement cannot exceed amounts that would be paid for similar services under Medicare. Disproportionate share payments cannot be more than the total cost of uncompensated care. And for hospice services, Medicaid reimbursements cannot be lower than Medicare reimbursements. So those are a few things to remember with those. Average annual percentage increase in Medicaid spending. It goes up every year, as all healthcare costs do. But you'll see in the last some years, this graph only goes through 2015, but you'll see that cost per year has been held pretty constant, a little bit over 5%, 6% a year, which is actually pretty good. The average, if you look over these years, has been 9%. increase. So there's gotten to be more of a management of the costs. Okay, so the Affordable Care Act, ACA, expanded Medicaid eligibility and said that people, citizens making 138% of the poverty level would qualify for that. So it was expanded out. And federal government now encourages states to expand eligibility to 138% for across the board, promising to pay 100% of the expansion costs for the first 3 years and 90% of those expansion costs until 2022. Types of Medicaid, there is what's called straight MA and medical assistance, and there's also what's called PMAPs. And what a PMAP is it's insurance through like Blue Cross Blue Shield, United Healthcare, or Health Partners. They get a discounted premium, so a discounted rate for that, and that also is part of the Medicaid funding. It's a prepaid account. Not all states did expand Medicaid, and this has created a gap. So it all depends on what state you're from, how much is covered, and there are gaps in certain states. Minnesota is on the better end of things in expanding that. Between those who qualify for Medicaid and those who qualify for market subsidiaries, there is a gap. More than 2.5 million poor uninsured adults fall into this gap. So because not all states cover this and not everybody qualifies, there is a coverage gap where people don't have what they need for insurance. 3 arguments for not expanding Medicaid is the median income eligibility limit for parents was only 44% of the federal poverty level. The cost of the expansion would result in a deficit, and expansion may infringe on the state's rights under the U.S. Constitution. So states have a right to make that decision. And the reason for expansion is to support Medicaid expansion because it provides medical insurance for charity care patients. So people who can't afford it are the ones who are benefit from it. Both federal and state governments fund Medicaid, and so it's a combined. The state contribution ranges from 17 to 50% of it, and the state share is based on the state per capita personal income over the national per capita times 45%. And that is it for this section on Medicaid.